So my name is Michael Giuliano, Dr. Michael Giuliano. I'm a Associate Dean for Faculty, Resident, and Student Development, and we're going to today be working with Beth Colts, who is the Senior Curriculum and Instructional Designer, as well as Joe Martinelli, who's one of the Senior Faculty Development Trainers, and George Knoll, who's also one of the Faculty Development Trainers. We have a fairly significant agenda in terms of reviewing how to get your electives put together, up and running, and started. And hopefully this will be interactive. So if questions come up as we're walking through this material, really stop us and unmute or chat in and let us know if you have any specific questions. So we really would like this to be interactive. Obviously, everyone involved in the production of this educational program have nothing to disclose. Again, our agenda is relatively liquid, but this is a rough idea. We're going to do a quick overview of the School of Medicine for those of you who don't have a lot of experience with it, and then Beth Colts is going to really talk about the meat and potatoes of getting your syllabus put together, how you're going to be doing assessments and sort of constructing your electives. And then we're going to talk about some of the standard models that the School of Medicine has been using to organize teaching, specifically the 1 Minute Learner, a standard model for evaluating our students, which we're now doing across all of our clerkships and all of our electives, and that's the comprehensive evaluation tool, which we'll be talking a little bit about. And then we'll touch on the standard feedback model. So we're going to touch on all elements of the triple jump of good clinical educational design, as well as some of the housekeeping issues clearly related to building your elective. Lots of people are involved in the elective team. I'm not going to go through everyone, but you're going to be meeting several of these people. But everyone here has been involved in one way or another, either in creating the administrative structure and or the ideas behind doing this. Any good educational event always begins with learning objectives, and these are sort of the broad learning objectives for this morning. As I've said, we're going to really talk about the School of Medicine, mostly about the unique aspects of it. And then we're going to talk about building your elective syllabus in terms of what the clear expectations are again. And then we're going to go through all of the core tools, all of which are built on entrustable professional activities. We're going to try to stay away as much as possible from educational jargon, but the entrustable professional activities are absolutely critical to understand. They are not just elective, just educational jargon. They're the backbone of the evaluation tool that we'll be utilizing, and there often will be the backbone of the learning objectives that you create within your elective. So that's real important. So just a little bit of history. I think most of you hopefully know that the school began July 8th, 2018, when we sat our first class. It's unbelievable to all of us that it's now been 7 years and we're already sat our 6th class and we're beginning to select our 7th class. We've graduated 3 classes already. And actually, I just heard one of my mentees just got her fellowship in pediatric intensive care. So we have matured to the point where we have graduates who have finished their residencies and are moving into fellowship. We always like to begin with the overall vision of the school. It's quite audacious. Every person in New Jersey, regardless of race, socioeconomic status, will enjoy the highest level of wellness in an economically and behaviorally sustainable fashion. That vision was created and is lived. Dr. Bonnie Stanton, who is our founding dean, regrettably, Dr. Stanton passed away several years ago, but her spirit is involved in everything we do. And now you're involved in the spirit of Dr. Stanton in terms of changing the way medical care is delivered and how education is delivered. The broad mission of the school is really quite inclusive and, again, really focuses on our professional roots of empathy and in terms of our perspective towards suffering and humility. Those are unique words, I think, in most mission statements. We really engage the community, and we have a very strong focus on lifelong learning and inquiry into everything that we do. We're really trying to create a community of scholars and a community of people all working together to learn. And we obviously want to work in the community, and the community is going to become our teacher. So those of you who haven't spent much time, I think what's really critical about our approach is that this is a 3-year curriculum for about 25% of the students who go on directly into their right into their residencies. We have a 4th year that's very personalized and individualized. And as I said, about 75% of students do take the 4th year. And many of the students you'll be interacting with will be 4th year students who are taking various electives on their own. They actually have a whole host of choices in their 4th year, including dual degrees, clinical immersion, research immersion, global health, and of course, serial electives, which is where you come in. And again, we really focus in the curriculum on integrating, using the community as our classroom, obviously applying knowledge, becoming lifelong learners, and of course, focusing on the fact that medicine is a team sport. I usually just had met symbols there, but I've been told to be more inclusive. So for anyone if I've left out, let me know, send me a note. I'll include your baseball team. We are aiming for developing competencies across all of these domains in our students. And this is actually a very busy slide, but when you really stop and you think about it, it's what we're really trying to accomplish is having a student that's well able to do communication skills, be able to reason through and gather data, and indeed manage patients. And when they reach you in the electives, they actually should have many of these core competencies developing. And of course, where are you fitting into the overall curriculum? Phase 1 is 16 months, phase 2 is approximately 20 months, and you'll be dropping into seeing students after they've completed these 2 core phases, and you'll be seeing them in the latter part of phase 2 or into phase 3, where they really should have some of these fundamental skills in place. And again, we think the students are quite well prepared for their elective experience because they're going to have had clinical and clerkship experience, fair amount of assessment and feedback given back to them. They've been driven to be self-directed learners and to indeed create their own growth goals, and they're constantly looking for feedback to improve. And the human dimension course has really embedded them in the community of learning, and of course, our health system science has taught them much about integration. We always use this slide multiple times because it just reminds us what this is all about. Any good educational design in any setting, clinical or non-clinical, really involves a clear understanding of what your learning objectives are and getting organized. And we'll talk about that. Having an objective assessment tool that everyone knows how to use and understands what it means, and then having a structured process of giving feedback to the student from the information you get. And everything, if you ever have any questions or doubts about how do I build this, always come back to this slide. And with that said, I'm going to slide over to Beth Colts, who's going to spend a little bit of time talking about really getting things started, the foundations of your elective. And I'm a baseball fan, as you might tell. If you build it, they will come.
Thank you, Dr. Giuliano. It's really nice to be doing this again. We did this for the first time last May, and I think it was fairly successful in helping new elective leads and even elective leads that have been around a while understand really all that we've been doing in the school and what is expected from the students when they come to your electives. And if you don't mind, I would like to, since there's only a few people on, I would like to quickly have you introduce yourself. And first, I want to start with our brand new member of our P3 team, Lynn Mancata, just to say hi really quickly, because she is going to be supporting you quite a bit, and you're going to be working with her quite a bit. You want to say hi?
Yes. Hello, everyone. Again, my name is Lynn Mancata. I look forward to working with you. You may have seen me already coordinating or speaking with you through the HMSong Phase 3 team inbox. So, look forward to the new year.
Thank you, Lynn. Dr. Borofsky, you have one of the newest electives. Can you tell us what your elective is and what your site is?
Sure. It's in the South, of course, for those that are, let's say, at Riverview or Ocean University Medical Center. So if you're down there, it's a 2-week elective in ophthalmology. I am a vitreoretinal surgeon, which is, by the way, I signed up for it because I had surgery this morning, but the last one canceled. So I signed up at 12 and 5. So I'll just do the 12 one, of course. I won't have to do the 5. But I understand I'm a vitreoretinal surgeon, but I understand what this is all about. So I like to pride myself as probably a good teacher. I understand what people don't know and know. So it's going to be really for a general ophthalmology. So by the time they're done, they'll be able to do a workup and understand about basic ophthalmology disease. They'll see diseases. They'll see treatment of diseases. They'll see photography, working up patient, how to take a vision, pressures, ask basic past ocular history and medical history. So it'll be basic ophthalmology for them, but they'll be seeing a lot of retina, but we'll see some glaucoma and everything else, cataracts, yeah.
Thank you so much for offering it. It is a great addition to our electives, and we did need more ophthalmology, so appreciate that. Just quickly, Lindsay Perella, want to introduce yourself really quickly, your site and your elective?
Yes, so our elective is called the Science of Safety, and it's a 2-week course. We're out of Edison at 343 Thornhill, and its focus is on patient safety, quality, and how we interface with our systems.
Wonderful. And I know you've taught it before this past semester, correct?
Yes, we had two groups.
Great. So if you have questions, there'll be time after my presentation at the end to ask a question, okay? And Dr. Erler, if you are there and want to unmute.
Yes, hello. I'm the chair of pathology down here at Jersey Shore, and I oversee the elective, the 2-week introduction to pathology and laboratory medicine. We've actually been running this now for 2 years, but I just wanted to see some updates and look and see if I can enhance some things.
Wonderful. Glad that you joined. And if you have questions, since you've probably have the most experience, although Dr. St. Fleur, you also have been teaching, is that correct? You have a couple of electives, or one elective, I think.
Yes, I do. I'm sorry. I'm off video because I'm trying to scarf down my lunch because I'm going to have to leave this meeting 20 minutes early for clinic. So I'm sorry about that. But yeah, my name is Rose St. Fleur. I'm a pediatrician. I do mostly hospital medicine, but I'm also the medical director for the Center for Breastfeeding here at Jersey Shore. So my elective is on breastfeeding medicine, where patients the students have an opportunity to learn about the science of breastfeeding. They get to see patients face to face, learn how to practically manage breastfeeding problems and issues. And they have both inpatient and outpatient experience in the hospital, as well as at our Center for Breastfeeding, which is our lactation clinic here at Jersey Shore.
Wonderful. And thank you very much for doing that. And Dr. St. Fleur is also a mentor for one of our med-ed elective students who's doing research in breastfeeding medicine.
Yep.
So that's wonderful. Thank you. Okay, so I'm going to quickly go through some logistics that are very important that everyone kind of follows through with this. Those that have been teaching for a while, pay attention to more like the 1-minute learner, the feedback, and writing narrative assessments, which are important for your assessments. So I'll go through these. These are important for those brand new elective leads to understand that these are the things that are expected of you and yet that you're responsible for. Communicating to your welcome letter, creating your syllabus. I'm going to spend a little bit of time on that, and then kind of just communicating everything that you can about your elective to your students, including expectations of the learning objectives and providing midpoint feedback, which is also a requirement for courses that are 4 weeks or more, and then completing your final assessment, which I'm going to walk you through how to create that final assessment using that from your syllabus. So next slide. So you will receive rosters of your students. You may have received rosters for students starting in January. You will be getting the rest of the rosters for the rest of the semester in the next week or so. And when you get those rosters, you will also receive a welcome letter template and a syllabus template if this is a brand new elective. If you've already had that, then you have the syllabus and you've developed it. But when you get that roster, it's important to know that you want to start preparing for students to be coming and preparing your syllabus and things like that. So 2 weeks before the block starts, You'll receive a reminder of the students that are coming each month or each 2 weeks, depending on how many students are signed up. And you want to complete the welcome letter and distribute it to the students about a week before they show up. That's important as well. We just want the students to know where to go about a week before. Next slide. You will receive this welcome letter, and it's a template, so you complete it. Some elective leads put in a lot of content that they want the students to know, and others complete the basics. But the syllabus is an important piece of this. And so I'm going to kind of walk you through that next. So next slide. Okay, so your syllabus and other materials, your course details will go into the syllabus. Basically, everything you put into your proposal, the design, can be put into your syllabus. It's all ready for you. If you need copies of your most recent proposal with that information, please let us know, and we will distribute that to you so that you can copy and paste what you need into your syllabus. But you already created an outline, you created the learning activities. And so the thing that I'm going to go over with you now is, and you've created learning objectives, and all of these were approved by the committees, right? But there is one piece of this that you do have to work on. So the entrustable professional activities, for those of you that do not know, are basically used as a measure to say that these are the things that these are the areas where students need to perform in order to at a certain level in order to be proficient to enter for residency. And so there are a list of these, and I'm going to go to those shortly, that every student needs to complete these EPAs or entrustable professional activities for us to feel confident that they are ready for residency. And these are nationally drawn. These are presented through our AAMC. And so everyone has these across all the schools. And we just want to make sure that our students are ready for these. And so we actually use our assessments based on these entrustable professional activities. So what we want you to do is be able to look at your learning objectives that you've developed and put them into the syllabus. And then you're going to map to the appropriate entrustable professional activities and also our educational program objectives. And I'm going to show you how to do that in 1 second, but understanding that the educational program objectives are our competencies for our school. So we have 2 ways that we really look at when a student is ready to graduate, and those are with the EPAs, entrustable professional activities, and the educational program objectives, which are the school's competencies. So at this point, I'm going to show you very quickly this sample mapping. It's there just as a guide, and you will put in your own. Okay, and this is important because you're going to be using the EPAs that you identify for your objectives. You're going to be using those EPAs as the ones that you will use to assess your student on only. And I'm going to show you the whole evaluation tool. There's a full clinical evaluation tool that you receive. Once you identify which EPAs are being assessed, you only assess those in your full evaluation tool, okay? So you will copy your learning objectives into that first column in this syllabus, okay, which is on I think this is on your 4th or 5th page of the syllabus, okay? It's the 4th page of your syllabus. Put the learning objectives in the first column. You're then going to identify which EPAs are mapped to those objectives. So for this one, it was 1, 2, and 3. And I'm going to show you how to get to there's a link on the previous page to the entrustable professional activities, which is here. All right. So when you scroll down, these are the EPAs. So your first objective, you will identify which EPA it goes with, and you will put that in. and then you will just go through and identify which EPAs go with each objective. It's important that you communicate this to the student, that they're being assessed on their learning objectives and on the EPAs that you identify. And then the other element here that you're going to look at is your EPOs, the educational program objectives. You will map to those in the third column, and those are also on our website here. Okay, and these take a little bit longer, but you shouldn't have too many objectives. But you want to go through here and really identify these, and it helps you to get to know and be aware of what level the students should be performing at for our electives, because this is basically they're leaving the school after this, and they should be able to be pretty proficient in these areas. Okay, so that's what we need to happen with creating that syllabus in this table, is for you to identify the EPAs and the EPOs. And then lastly, let me quickly show you the elective evaluation tool. This is the full tool for clinical evaluations. So the descriptions are below, and you're going to go through and pick out which ones you're going to evaluate. And then you're going to use this rubric to kind of decide where they are, what level. They should be at least at level 3 or the third column over. Okay. And that's what you'll do, is choose the EPA that is associated with your learning objectives. And when you get the evaluation tool, you'll go through this and just evaluate the ones that you picked out. The rest you can put NA. Okay, you do not have to do the whole thing. For those that have a non-clinical, they have to put their objectives in, and I don't know if we have anyone on here, and write up a narrative, formative and summative narrative. And all electives are evaluating professionalism and growth, EPA 17, and EPA, sometimes EPA 18, I think is. So it's important to relate to the students either before, but if you aren't going to be there the first day, but we do encourage that there be some type of a first day orientation to kind of go over what I just did, the syllabus, the learning objectives, where the students will be, with whom, all of these things. Some elective leads create slides, others create, put it all in the syllabus and give it to the syllabus to give it to the student to review. But either way, it's just important to get them oriented, and then let them know that they are going to be given feedback, midpoint feedback, for those electives that are more than 4 weeks or 4 weeks or more. And that also, just for you to be aware that many students have some idea, they've been putting together growth plans for themselves in clerkships and even before that, where they have reviewed the EPAs and they know which ones they want to work on, believe it or not. And so they may come to the elective having some awareness of where they want to work, and may share that with you and ask you for feedback, which we really encourage them to do. So just be aware that they may have already created a growth plan for themselves and may be looking for your input on this, on their own EPAs. So then I just want to let you know that we have many students now. We have 168 in our class, and so our class size that are going into electives are growing. Each student has a phase 3 plan for their final year. We have 2 electives the students can take during their second part of their third year. And those are during their advanced clinical rotations. But then they have a whole, if they're not going into residency for their fourth year, they have a whole year of electives that they're taking, and they put together a pretty formalized, individualized plan for their fourth year. And that is reviewed by many people, their advisor, mentors, and an elective, a review committee. So it is something that they have to basically commit to doing. And so this is why we try our best not to cancel electives, because as you can imagine, with that number of students, it's really hard to find a replacement for them for their plan. So just ask if you can be really careful about saying which times you're available, which blocks are available. That's really critical that you would commit to that. And if you don't think you can do it, having a backup plan of another faculty member that can cover for you. So that's been pretty important, okay? If you do not receive an assessment, you will be receiving assessment right after you complete the elective. And if you do not receive one, please reach out. Those assessments are due within 3 weeks, but no later than 4 weeks. We have a requirement that all assessments are due to the student within 4 weeks. And that is something that we are required to by our accrediting body. So it's really important that you complete those. And if you have any questions or do not receive one, please reach out to us. We know it's just really important to get that done. There are important faculty teaching policies that you will find here that we do want every faculty member to review. They are all on the policy stat, and the link is here, and you'll be receiving this. You should receiving this in a new elective email that comes out from us, but also if you need it, please reach out as well. We will be distributing these slides afterwards. And next slide. It's important that we have a positive learning environment for our students. This is something that we do require and that we do follow up on. So these are 3 ways that are important for your learning environment, that students are engaged, that they can ask for feedback, that they can really have trust in those faculty that are teaching them, and that they have meaningful work, and that their safety is important, and that if there's any questions about their safety or issues that are coming up, it is important to reach out to us. And I'm also going to just go to the next slide to share about Title IX. So if there are complaints and student mistreatment concerns, students will go to Title IX. And also it's important that if you have questions, and we've had questions in the past about students that there were concerns about, and we have a process here that you would contact Dr. Lori Sullivan, the Dean of Student Affairs and Wellbeing, but also if there are any other questions, you can contact Diane Russo.
And again, as we've talked about, constructing your elective is so critical in terms of being organized. And we've already given you a pretty good outline of how to get organized, but we actually have a pretty specific proposal for you in terms of potential clinical model to help you get things sort of put in place. Organizing your clinical teaching, you've already thought about this a lot in terms of how many patients, how long, what are they going to learn? All these things are really in your design of your elective. Obviously this is more of a focus on the clinical electives, but I'm sure in the non-clinical ones, the same thing. And you've thought about how to evaluate them. The real question is what's going to be the model that sort of overlays this? And we would propose the 1-minute learner model, which actually was developed by our own Vice Dean, Dr. Hoffman. And it's a very simple model. It really incorporates what we've really just talked about, but it does it in a little bit more of a structured way. It's basically a structure for having a conversation about clear expectations and goals with the student at the very beginning of the elective, and then subsequently each day as they work through it. And it really, I think, is critical because it really sets up expectations for the students and, of course, for us. And I think why it's really efficient is that it really gets everybody on the same page and moving to start learning almost right away. Now, the 1 Minute Learner really is a little bit of a lie. They thought it was a catchy title, but in reality, it's more like 10 minutes, at least the first time you use it, because the components really, all of the components usually get used the first initial time, but after subsequently, I think it gets down to 1 minute. But basically, the 1 Minute Learner has 7 quick little steps in it, always preceded by a huddle. And again, the huddle is really about getting a sense of the student. You don't necessarily need a huddle every single day, but when you first meet this student, it's a real good idea to have some idea of where they are. Are they at the very end of their phase 3? Are they at the very beginning? What areas are they indeed thinking about going into? Sort of what their broad goals and objectives are. Get a sense of what their clinical experience is, their experiential level, all of those things that are so critical for you to get a sense of where's the starting point. And again, you don't need to do a huddle every single time, but certainly initially on that first day when you have that first orientation conversation, this is really a great idea. And then once you get started, the 7 steps are really, what are we doing today? What are we going to accomplish today in this group of patients that we'll be seeing? So often in medical education, it's really quite fragmented. One of the big advantages of having an elective where especially there's a small group of faculty is it won't be as fragmented. And indeed, you can set goals over the course of a week or 2 weeks or 3 or 4 weeks. And it will be really critical to sort of talk with the students about what their goals are, what your goals are, and sort of try to map those out over the next few days and weeks. The clinical environment that they get into may be different, although at this point they're pretty experienced. So, who's the patient I'm going to see? Where do I get the chart? What's the logistics and the flow of patients? All those housekeeping issues that we sort of take for granted. But you really need to spend a few minutes with this so that students aren't disoriented. And then, of course, how much time are you going to give them for each of your patients? What's the setting that you're in? Are you in an emergency room environment where they've got 6 minutes, to do everything? Or are you in an environment where you're going to give them much more time? Give them some sense of expectation about how much time they're going to have for gathering histories, how much time for doing the exams, all of those real practical aspects. I mean, personally, I had students in the ICU, neonatal ICU, and I neglected to tell them how much time they had. And one time I sent the student off, he didn't come back for an hour and 20 minutes because apparently he got the history of everybody in the family down to like 3 generations back. Again, presenting is very parochial in different settings. It's really important that the students understand what the expectations are for a presentation. Do you want a quick 2-minute, 3-minute rapid presentation? Do you want a more prolonged presentation with a lot more history? Each setting is different. It's really important that students get some idea about what your expectations are. And again, depending on the setting you're in, the students actually can contribute to your own notes. So the regulations and the policy around charting and what they can do is important for you to review in your setting. Just as a little anecdote, not just anecdote, but an asterisk, the more they are involved, the more they learn. And indeed, we have found that students really should be involved in charting. It makes them really feel like they're part of the team. And as I said, there are parts of that chart that they're writing that obviously need to be reviewed, but can be included in your note to actually save you a little bit of time. And then, of course, the use of questions. Questions are the oldest and most valuable tool in our educational toolbox, but it's also the most abused. It really is, I think, critically important that we think about what questions we'll be asking students as we take them through clinical cases. And indeed, think deeply about them so that we drive students to higher order learning. It's not just the facts. I mean, clearly they need to have facts, but it's the application of those facts, how they put the case together, how they take the case apart, being able to generate differentials, and of course, make judgments about what to do next. And these higher order questions really should be the majority of the questions that we ask when interacting with students. The feedback step, the last step, we're going to spend a little bit of time talking about in a minute with our own structure, but clearly you want to have a plan for giving feedback. And probably more is better. The more intimate to the interaction, the better. You have to obviously measure it in quantity in terms of what time's available, but as a general rule, I know I personally try to give a little bit of feedback after each clinical interaction, and I always make time at the end of the day to sort of reflect, how did we do with the goals that we've set for today? How do you think you did? And obviously we'll go through that feedback model with you very quickly. So I think, again, the 1 Minute Learner is a great little tool. You don't have to use every one of those steps every single time, but I really think it's really incredibly effective. And if you're ever coming by the office, we have a laminated card that actually has the 1 Minute Learner on here, so it really makes things a lot easier for you. Of course, why are we structuring this, setting goals, creating this whole process, is that we want to obviously link all of that to an assessment. And as Beth has talked about, your learning objectives, the EPAs and EPOs, and your learning objectives should be directly linked to the assessment tool that we use, which is the same background. And indeed, evaluating students with the entrustable professional activities that are embedded in our eval tool, called the Comprehensive Evaluation Tool, is absolutely critical. We've sort of touched on the CET briefly. We use this tool as the primary measurement tool in all the clerkships and all the electives. The students are quite familiar with it. And again, basically, you need to cherry pick in the CET what EPA domains you want to evaluate, pull them out from the tool, and make certain that you understand and they understand exactly which ones you're using. Beth has mentioned, and I have mentioned, the EPAs multiple times. They are the things we do every day in work. Take a history, do it, create a differential, interpret the tools and tests. Many of these are self-evident, but again, you may want to spend a little bit more time on certain ones. For example, the handover process. If you're working in an inpatient environment, how the student handovers patients. If you're working in an acute environment, can they recognize the sick or non-sick patient? These are other EPAs. Again, if you select them as part of your elective, you really need to assess them. The original AAMC had 13 EPAs. We've actually added 5 around communications. So I think actually EPA 14 is sort of universal. If you're dealing with chronic patients with chronic problems, EPAs 15 and 16 will be critically important. EPA 17 is for everyone. How do I grow? And EPA 18 is about the determinants of health, again, pretty universal. Again, I think Beth has already shown a screenshot of the clinical evaluation tool, so I won't go back through this again, but they're really quite simple. They're all structured the same way. There are four boxes with behavioral anchors. Directly observe the student and check the box in which they're functioning most consistently. And I think that that's pretty self-evident. I have to be honest, I think a lot of times we don't watch a lot of what they do. We only sort of see their oral presentation, which is only just one EPA. So if you're assessing their communication skills with a patient, you need to see it and watch it. And again, our evaluations are not just the checking a box on the CET form. You also need to do narrative assessment. And for me personally, I know I have to take notes as I interact with students, so I can keep track of examples about what they're doing well or where they're having some difficulties. And again, narrative assessment is something we always want to make certain no one forgets. And in the eval tool that we give, you can see here that there are 2 separate boxes. Summative narrative assessment is really sort of the stuff at the end. The formative stuff, narrative assessment, is the things the student needs to really work on, would never be included in their summative letter, and really is the place for you to be honest in terms of where the students has opportunities for improvement. And again, I never ever want to leave the opportunity to make certain that we're all taking notes on our students, looking for specific examples of observed behaviors that really help us, and indeed in the narrative assessment, giving them actionable feedback so that they can actually improve, which I think is absolutely so critical. And again, as I suggested before, I know I deal with lots of students. My own personal bias is always to sort of keep a sheet of paper and take notes so that you can have raw material for the narrative assessment. And of course, there are very specific requirements of mid-elective sit-down written evaluations for the students that they receive, Although in reality, the feedback they should be getting should be much more frequent than that. My favorite slide, third time, organized everything. We have clear learning objectives. We structured all of this learning. They've interacted with patients. You've observed them with a clear sense of what the CET specific domain is that you're going to do. Now our job is to transmit all of that to the student with structured feedback aimed at growing. And we've done that by creating a model that we try to utilize consistently. And I'm going to ask George to jump in here to talk a little bit about the Forward with Feedback model that's been created for all of the different environments around the school.
Okay, so the Forward with Feedback model, if we go to the next slide, there's based, in our group and a lot of different people here, so that the classic ND model of feedback wasn't enough. It didn't really go far enough. I mean, of course, feedback is, you want it to be expected. You want to know when it's coming at a certain time interval. Well-timed, you want it on observed data. So you leave out personalities and bias that way, and you want it in a regulated quantity. And, as we said, the ND model of the classic ND model was, didn't go far enough with it. So again, we want it descriptive. We want to look at decisions and actions and not, what somebody intended to do and what they were doing. And so we want to limit it to remedial behaviors and not a personality trait of someone. Should always look at the learner's perspective for what, where they're seeing things and give guidance, and you want a resolution, to a problem. Have a defined timeline for things. Think of, performance evaluation, that everybody goes through. Same type of thing. You want to improve and you want to get better. So as we said, we had a big group here that put together a few years back, our Forward with Feedback model. And on the next slide, we'll come up and we'll show this. So it's a bidirectional conversational approach. So what is that? You have a relationship between the elective lead and the learner, the student, back and forth. So you want to start out with your goals, and where's your goals coming from right away? Your learning objectives. And now, of course, you may have a certain specialty, cardiology or ophthalmology or whatever, and you may have specific goals in there also that you want them to go through. The second phase of this at the 3 o'clock position on the clock face there is the person's self-assessment. So very important and critical of saying, well, what do they think of themselves? And you'll find that students are either overcritical, right? Or they think everything's great. So what is the real truth? In between somewhere. So that's how, you want to moderate between that and saying, well, you're really doing well with this. What do you think about this? And you want to come to sort of an agreement. So again, there's double arrows in the middle. There's a back and forth relationship, between that learner and the lead. And then you can go across and say, all right, here are the gaps and the strengths. Here's the positives and minuses of what, you have, and you're agreeing upon that. Then you can come up to that 9 o'clock position on the clock face here into a coaching plan. What do you have to work on? What do you not really have to work on that much? So you want to, stress, the gaps there and modify and then work on getting better. And then if you, have something that you don't agree upon, you go back again in that model. Say, well, I don't think that's true. Then you go back to the student again, and you go around that clock face and then go forward. And then you get to the next group of goals or the next goal. So all the goals and coaching have to be SMART. So what is that SMART? Specific, measurable, attainable, realistic, and timely. So really, it doesn't really do the learner any good if you say, in a cardiology sense, and you say, well, you got to read some more on radial artery catheterization. So what does that mean? Look in the textbook, go to PubMed, go to Dynamed. Do I look at this by the end of the week? or next week, if it's, a several week, course. You have to tell them and say, gives them some direction and some specifics and say, oh, here's 2 articles that are new on, radio catheterizations, so radio arteries, and concentrate on the abstract. We're going to look at 3 or 4 points in there tomorrow, and we want to discuss that in relation to one of the patients that, we saw in the past year.
And again, it's important to emphasize that, the original ND model, which most of us have used for ages, has really been shown not to necessarily change behaviors, which is why we went beyond that model and incorporated the good features of it with the forward feedback model. And again, it's so critical that students recognize when they're getting feedback. And, they've been all trained on this model as well. So I really, really think it's important that we use this structure so there's no doubt in their minds that they're actually getting feedback. So we've, in a relatively short period of time, have really traveled a lot. I mean, we've talked about how to use different resources to sort of run your elective, get the housekeeping stuff done, the welcome letter and the syllabus. Obviously, probably more importantly, we've really talked about how to map your learning objectives that you want to the more educational elements of the EPOs and EPAs. And hopefully you've got that down, because that's probably the biggest lift for most people. Obviously, we've spent most of our time talking about the models that we use, specifically the 1-minute learner, to really set expectations and structure the clinical learning. We've talked about the evaluation tool, or the comprehensive evaluation tool. That basically is the tool that we'll be using to evaluate students in all settings. And then, of course, how do we give feedback? How do we give feedback to the students using a forward feedback model, which I think we've just reviewed and really have given you a good sense of it. Before we walk away from this, I think it is important for you to recognize that we are actually doing faculty development in very different settings. But we're not just doing faculty development. We're also doing resident development, and we're also doing student development. Actually, this program is part of what we call Framed, where we're dealing with faculty and teaching them to become better educators and assessors. But the reality is that most of you are functioning in settings where you also have residents working. And we actually have a program called Rattle for the residents that really parallels this. And we're developing our students as educators as well. So the students are actually getting this kind of development. So they're learning about the EPAs, the EPOs, learning objectives, growth goals. So hopefully we're all working towards coming onto the same page and creating this very common culture of learning and teaching. And by doing that, we're hoping to actually transform medical education, certainly, and even healthcare delivery. And obviously the strong focus on safe learning environment, obviously these common models that we've just talked about, the EPAs, I think you're going to get sick of, but hopefully you've gotten a good feel for them. And of course, everybody focusing on higher order thinking. There's some resources that we'll send you. These are all active links that will bring you to resources that will take much deeper dives into the subjects that we've really covered here. The Frame video webinar series actually talks about other aspects of critical thinking and teaching critical thinking and talking about educational research. Many of you may want to think about transforming your elective work into educational scholarship, and there's a webinar on that. Obviously, FERPA is about the privacy of the students and the educational material that we're doing. And LCP is the longitudinal clinical placement program where students go into their initial clinical experience. And that webinar series really talks about a lot of the basic issues that we've really talked about. And of course, they're general resources for everyone.